Hello my friends, it's Roger, Mud Fossil University. Quite a serious subject today. A very good friend of mine, his sister was pregnant and lost her baby. And she was 5 months pregnant, and I decided to see if there was anything that is in the transition metal situation in a baby's body, because I know in a human, once you're born and you're out in the environment, these transition metals are 100% of your health. So I started looking, and lo and behold, biotin, forget about all these other things, biotin deficiency. What is that? Because this is your digestive system. It uses enzymes, all this stuff. As soon as I saw that, bada bing. Now listen very, 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 very carefully. If you have anyone that ever wants to have a baby, you better listen to this as closely as you can. Put everything down, listen. I'm not giving you medical advice. I'm just telling you these are the things that can affect a baby's health. And they have to be known immediately, because there's a very short window on this. Now, this is about babies' first tests, and apparently they do this or whatever. And it talks about different states have different tests. Now, you should look into what your state is. Now, biotinase deficiency is an inherited condition. It might be, it might not be. The baby has it when it's born, that's why they think it's inherited. Or maybe there is a gene, they say there's a gene that does this. I don't know. But I'm just going to say, either way, it doesn't matter. Very serious. Unable to reuse and recycle the vitamin biotin, because the body needs free biotin to break down fats, proteins, carbohydrates effectively. Individuals with biotin, means they don't have enough, are less able to process important nutrients. This is what I've been saying. It's transition metals. The biotin creates the transition metals. There are two types of biotinase deficiency, that differ in severity and treatment. One of them, well anyway, both forms of the condition can cause serious health concerns. Serious. Children with biotin who are identified through newborn screening and begin treatment immediately usually remain healthy with normal development. Immediately. Do you listen to me? Immediately. Do not let, because these are irreversible neurological changes that happen. I've been reading up very carefully on this. And once you're damaged, you're damaged. Your child is going to have a problem. So, and that was low birth weight and lethargy and all kinds of issues, skin rashes and so forth. Now, so it says this deficiency occurs in 1 out of every 60,000 births. Condition is most common among individuals of European descent. All right? I guess that's white Caucasians. However, it is reported among individuals Turkish, Saudi Arabian, Japanese descent as well. So this is a problem. Now, to follow testing, your baby's doctor may ask if your baby is showing any signs of bias. See early sign, which is lethargy and all these things I just talked about. If your baby has certain signs, your baby doctor may suggest starting immediate treatment. Well, what we need to do is find out what's in the body of this baby. We don't have those blood tests to show every metal and everything that's in the body, in the blood of the baby. You just go dip and take a quick test. I know they can make these machines that'll test this stuff. I don't know if they have them yet or not that are efficient enough, but they could do that. And the second thing you want to do is take a fecal sample, and does the baby have the bacteria that process the enzymes, and the enzymes make these metals, and the metals are the ones that are missing. That's all it's all about. So it says if your baby's screening result deficiency was out of range, your baby's doctor or the state screening program will contact you to arrange for your baby to have additional testing. So if it's out of range, they say, come in and see what he's doing, But if it's out of range, you got a problem, because you don't know how worse it's going to get. You have to be able to see these things in a blood sample. So it's important to remember that an out-of-range screening result does not necessarily mean that your child has a condition. See it in black lines, don't worry about it. Well, you should worry about this. That's my feeling. I could be wrong. Maybe you could go on your way. An out-of-range result may occur because the initial blood sample was too small or the test was performed too early. No, too early is not too early. In the womb, is not too early, because the baby has to be able to deal with the things that's coming into its body somehow. Now, does the mother have it all processed and ready to go, going through the placental barrier? I don't know. But all I do know is that baby has to deal with things. And that baby is getting something, because I believe they poop in the womb. And I believe they could check that poop in the womb for these enzymes. And I do think they might, because I saw where they did tests in in utero for cells, and they were looking for, I believe, biotins. Now, so anyway, if you have trouble, we'll give you another test and we'll confirm that you're okay, or you don't have too much of this stuff, and you'll be fine. Follow-up testing must be conducted as soon as possible to whether or not your baby has the condition. Extremely important. Do not let this go by. Ask your doctor about this. This is so critical. And it's lethargy. It's say, he's got a little rash today. He's just a little colicky. It's no. Well, who knows? I mean, I don't think you should go insane, but if my real rub is you don't know, because they've never taken a blood sample that can tell you these conditions. They've never taken a fecal sample, I'm sure, that can tell you all these conditions. And those conditions are going to be representative in a normal database that will say, geez, all the kids that never had any issues, no allergies, no this, no that, no other things, they had this, and this. But the ones that got Alzheimer's, and they do know, I mean, well, they got all problems. All the ones that have problems, they're starting to understand it's related to metals. I mean, literally. And Alzheimer's, they find all kind of aluminum, and there might be some iron and things like that that are problems. They're excessive or not enough. And I believe they build up, they're excessive. You know, they're finding heart issues now from, I think it's magnesium, which the conductivity of the electrical signals in the heart doesn't work well when you have a low content of magnesium. And then they think that might lead to some other issues. Look these things up. Don't take my word for these things, because I'm just throwing these things out. But I do know that, in other words, do your own research, capiche? I'm telling you what I have been seeing, a little of this, a little of that, and I could be totally wrong, because I don't have any obligation to be right. I'm just saying what I see. And when I do see it, I normally show what I see and document it. I'm not really that crazy to just start throwing insane things out there. However, I do see that very few people look to see what I do present and start calling me crazy. That's an issue right there. Because maybe I am crazy, but if you don't look, you have no clue if I am or not. And once again, all I'm saying is all we need to do is have databases of what does a baby, what's the chemistry when they're born, what's in the blood, what's in the fecal system, what bacteria does that baby possess, and what conditions does the baby, exhibit. And then with that database, and then you follow that child. And then you follow everybody. Everybody does that every now and then. I don't know, now they go once every year, they do this. Well, go every 5 years for one of these things, or whatever. But, and if you have an issue with yourself, you go in and you take one of these tests, and then you look, what is everybody supposed to be looking like? Well, I'm way off of this one, I'm close on that one, I'm good on this, Then see what the bacteria is. And I'm almost sure there's going to be characteristics that will display, that will be, helpful. Let me put it that way. I'm not saying the whole world be healthy, be ever sick again. But right now, it's just not right to not have to have that information available in a large-scale database. Now, it may exist, but I don't think it does. I would like to find out what my blood chemistry should be and what my bacteria should be, that would be a norm. I have no idea, and I can't find that. And I've tried to contact a lot of companies and a lot of doctors and places and things, and nobody has an interest. And I understand everybody's got things to do, and the guy's a little crazy. Oh, you look at him, he's doing this and that. He's just trying to play doctor or something. Well, I'm trying to make something better for people, and I don't have the ability to do it. But you got to go to your doctors and say, look, I know this guy's talking about something. You better look at this and see what you think. If he's crazy, you tell me he's crazy. But if he's not crazy, I want to make sure my baby doesn't get injured because of not paying attention to this. I want to know what his bacteria is supposed to be like in his little gut. He's supposed to know that. Or, because they can go in and do it in vitro now. I mean, in utero. Hold on a second. All right, it's going to get a little bit technical. I'm going to go into the process that creates opals and carboxylation, and how these exact particular parts of the anatomy become exactly these specific colors. So it's going to get a little bit technical, but you can do it. It's absolutely no problem. If you got an 8th grade education, I swear, I am not lying. If you pay attention, don't let your mind lock up. Don't think about what you were heard before. Pay attention, and then if you reject it, God bless you. If you like it, you will have learned something. All right? Thank you. But my point being is that from this point forward, it's getting a little more technical. That's all. Very, very simple, actually. All right, so now I've been looking into the chemistry a little bit of biotin, and it has a sulfur component to it, and sulfur is in the skin. Now, I do the mud fossils, and I have the actual mud fossils, remnants of creatures, and in certain conditions, the creatures will preserve almost like they were still alive. The chemistry is there to look at, and anatomical features are there to look at. Everything is there in its normal condition. Now, it's turned into minerals, but you can back into what the original material was, and it's fully understood anyway, because all of the it's just an anatomical. It's the same as the human are today. Exactly, creatures are the same as they were then as they are today, only they were a lot bigger. Now, so I'm saying that the sulfur component points to skin. Biotin, all the time they're talking about skin rashes, this and that. It's all kinds of things about your skin. Now, what is your skin? It's the most important thing you have when you're born. That protects you from everything. And you need that in working correctly. And otherwise, you start to deteriorate, starts to crack. And, it's got to have all of these different components to keep it supple and elastic and, impermeable and, all of that stuff. And some people have it, some people don't. And the ones that don't have this, and they don't have that, and they don't have sulfur. I see sulfur and aluminum are two extremely, and well, of course, silicon. Silicon's 50 times denser in your skin than it is anywhere else in your body. There's some good amounts in some of the connective tissues, but primarily it's your skin. It erodes off your skin. And anyway, there's different materials that are just there in different concentrations in different parts of your body. That's the way it works. And I understand this because of the mud fossils. And then I understood where the metals were and how they moved around the body. And then I started finding them in the heart. And I'm going to show you that right now. Because opals are nothing more than saturated with blood body parts or shells or anything organic will absorb those metallic molecules and spectacular colors. Alright, this is a cross-section of a human heart, and of course they did some plumbing arrangements here, but there's ventricles. There's a right and a left ventricle. One of them pumps the red blood, one of them works with the used blood, the vein blood, and they sort of and there's muscle, and then these are like the little heartstrings, I believe they call them, and the ventricle walls, and then you have all your aorta and your plumbing and all that business, and then around the outside is what's called fascia and the cardiac tissue, muscle. Now let's go and look at a different heart. All right, any doctor hopefully that works on hearts, or any doctor at all, hopefully would understand this is a cross-section of a heart. Same thing we just saw. Now, what are we looking at here? The red is obviously blood. I talked about the cardiac muscle around the outside. I believe this is what we have here, cardiac muscle. This is fascia, the brown-looking stuff. And then, of course, you have your plumbing, that, your aorta and all that business. It's not completely looks like the other one, but okay, this is a heart, just like the other heart. only this one has been petrified in blood. And I can say that because these transition metals are the transition metals that are in human blood. And how can I say that? Or they're in all blood, because that's what moves. You see all these little different colors? Those are all different transition metals. And that is in the cardiac tissue. That's a cardiac muscle. Same thing here. Then you have the fascia that goes around it, which coats all your organs and so forth. Then you have your ventricle walls inside and your little heartstrings all over the place. And then you have the blood, and the blood is very red. But you see these colors everywhere. And you see all the different colors here, all the different colors here. And that's because this is flush with blood. This is all flush with blood. This is a puddle of iron blood. And this is the ventricle walls with all the little heartstrings. You can see they're the same color. Well, why is that? They wanted to find this exact transition metal to bond with. That's what their nature is. And all of them did that. Now, look over here. You see this is cut here? This side here has the metals. They settled down. My estimation is that this was the lower part of the heart. This was the upper part. And when you cut it off, the red blood is up here. The metals have drifted down to here. Now, so you see all these metals all in the blood? If they're not there, you're going to be sick. Let's say you didn't have any blue in here. You're going to be a sick puppy. That's the way it works. Absolutely. See, green, blue, yellow, orange, red, all kinds of different colors. Look at them all over the place. Turquoise, mauve. There's all kind. That's that. There's 100 different transition metals. Now let me show you what the main ones are, and then you'll just see. And if you don't see it, not much I can do for it. All right, this is what we're talking about. These are the metals. You see all these plus 2s and 3s and 4s and 5s, and even a 7 over here, manganese. That means that they they have an affinity to grab onto other things and grab on and let go. It depends on what kind of a pH they're in. Do they need something to attach to it? Do they have too much attached? Do they want to let it go? That's the transfer, and they float through your body. But you cannot get these in your body unless you have enzymes in your system that go out and harvest these things. It's just something about it. It's like a chemistry kit. But to get that chemistry kit, you need bacteria, and the bacteria literally make the chemistry kit. They literally make it. They make enzymes. The enzymes make these. If these kids don't have the biotin in their body, they look for the enzymes. They look for the correct enzymes, not for the metals. They're looking for the enzymes, and not understanding that the enzymes come from the bacteria. I don't think. I just can't understand why they don't get it. All right. The bacteria creates enzymes. The enzymes create the soluble metals that are in your body. They're not necessarily little chunks of metal or anything. You can see them in those colors that we saw before. Now, it's carboxylation. That's what I've been talking about. Now, organic disorders, fatty acid oxidation. Now, these are disorders. Now, why are they disorders? It's biotinase deficiency, usually presents in infancy. Immediately they can see this, and it can cause irreversible damages instantly, virtually almost right away. And it resembles some of these different diseases, convulsions, later presentation, predominantly neurological symptoms possible. They have to do an assay for it to see if it's in your body. Is now a part of many newborn screening programs. That would be fabulous. They should find out, because if it's not there, the kid's going to be sick. I can't guarantee anything, but I would tell you what, I wouldn't want to see any kid without this biotin. Now, the infants they say that screening programs frequently identify infants with partial deficiencies. If they have a partial deficiency, they got a problem. They're not going to be healthy. They're going to have a partial deficiency. Means it's not right. You got an issue. Now, these infants are likely to remain well, but late onset symptoms have been reported. Of course they're going to be reported. A lot of them won't be reported because they'll just think they don't feel well, or they're just always tired. This deficiency usually causes earlier and more severe disease. And all it is, you're missing that biotin. Coma, red scaly skin, and this is the alopecia, red scaly skin, keratitic, ketoacidosis. All those things I sort of understand because of the chemistry, mostly the skin chemistry, but it might have something to do with fascia or other things too. But anyway, urine organic acid analysis shows increased all of these things. So why are they increasing in your and they're all acids and things. Now, so what's the treatment? Large doses of biotin usually produce it. It's like that. They fix them, and then they're done. Improvement, almost complete disappearance. This is so critical to look for this. Now, and you may think your baby's just not feeling well or this or that. The real key is when they're feeling like that, you shouldn't have to go there and say, what do you think? And he's, well, let's try this, let's try that. No, it should be, well, let's take a quick blood test and a fecal sample and we'll see. Now, well, he seems fine with that. I guess he's just nothing I can say. Well, let's look a little at this. But not to be able to say what is the standard that we should be looking for here, I don't think that exists. That's my point. I don't want to offend anybody by stepping on people's toes. This is health. I understand from my mud fossils what's going on here. And I understand even more than that because I think in the lungs, the carboxylation gets to this point where the chemistry in the lungs, and these are lungs of a different creature, not a human creature, I don't think. And those are the colors of the transition metals, and the blood is all that little reddish looking stuff that runs around there. It flushes through those metals. I mean, well, they're metals, they're metal crystals. And those metal crystals, I believe, somehow interact just like they do in a car's catalytic converter, where you have some kind of platinum coating that's down there that lets the molecules adhere and burn or something like that. Something's going on here like that. Because these, I believe these add to the carboxylation, carbonic acids that you squirt out of your lungs. I'm finding these colors are all over these lungs. I mean, they are spectacular colors too. Just like that heart. Hearts and lungs, same stuff. Blood. All right, this is from the National Institute of Health. This is talking about the same thing, carboxylation. Now they're talking about a gene being deficient. And what does it say here? This gene encodes an enzyme. Same thing we taught, enzyme that catalyzes the binding of biotin to carboxylase and histones. Histones, you know what that is? Allergies. All right? The protein plays an important role in glucogenesis, fatty acid synthesis, branched chain amino acid catabolism. Defects in this gene are the cause of hydrocarbonylase synthesis deficiency. Well, maybe yes, maybe no. I don't know if they understand about the bacteria. If the bacteria is not there, you're not going to have this. The enzymes aren't going to be there. You know, I'm not sure what they understand, but I know what they don't understand. And they don't understand that they need a huge database of just three things. What's in the blood? Everything. Every little bit of it. What's in the feces? What bacteria, viruses, parasites, everything they got in there. And then what kind of health conditions does this person have? I'm going to close the case at that. Go to Mud Fossil University on YouTube, which you're probably here now if you're already watching this, and find out about reality and find, you know, I mean, I know I'm not saying I can help you get healthy. I'm just going to show you what I have found. Then you have to go on your own and find out things. But I have found out a lot of things that nobody's paying any attention to. And it's a kind of a tragedy because a lot of these things are very important to everything in your life. All right, so that's all I can tell you. Case closed. Roger, over and out. I love you. God loves you. Try to make this thing better. Do what you can. These children, these little babies, it's not right. If anything goes wrong with them, it just doesn't make me feel good here to think about this, that it might be just overlooked in such a manner as to be so simple. Because the correction of this is like instantaneous. And I know what it is. I can see it. I can feel it in my body. I didn't, you know, I could be wrong, but if I was, I think they should at least investigate what I'm saying. And they should look into these mud fossils because they would learn so much. But I remain powerless. All right, that's what we got. Thank you.